Cancer is a huge health problem. There are about 2 million new diagnoses and a little over 500,000 deaths a year from cancer. It's the second leading cause of death, just behind heart disease. Still a very major health problem despite all the advances that we've made in recent decades. About 18 million Americans have a diagnosis of cancer, so probably everyone knows one or two people that are living with a diagnosis of cancer.
We've really made incredible progress in the past 3 decades. Our mortality or death from cancer has decreased roughly 30%. We've seen really impressive improvements in melanoma, leukemia, and kidney cancers due to improved screening, better treatments, and better education.
We have made a lot of advances in cancer over the last decades, and part of this is people recognizing that smoking is bad. Stop smoking, it's the best thing you can do to prevent cancer and heart disease. But there's also been advances in treatment and in early diagnosis. Those have been the drivers that have made things better. Houstonians are very fortunate to have 2 NCI-designated comprehensive cancer centers. MD Anderson is one of them, and then the Dan L. Duncan Comprehensive Cancer Center is the other.
The Dan L. Duncan Comprehensive Cancer Center was founded in 2006. One of 3 cancer centers in Texas to have a comprehensive cancer center status.
The center has met the standards of the NCI, not only in excellent patient care, but also in cancer prevention and outreach to the community, as well as cancer research. The center has developed quite a bit over the years. It started with a big focus on breast with Dr. Kent Osborne, and then grew into the comprehensive care for all cancers. In terms of Baylor College of Medicine's contributions, some of the big standouts are our strength in genetics. The Human Genome Project, Baylor was a huge part of that, and that was when we first sequenced the human genome completely. A very major breakthrough in science and in medicine. As the technology improved and things got more rapid, we could start thinking about sequencing individual people's genomes. Now we routinely sequence every patient's tumor, and it helps in some cases with earlier diagnosis.
It also allows us to tailor therapy to the individual and the individual cancer. Many cancers like breast cancer, by knowing the subtypes, we can tailor the specific therapies to best treat that cancer and help the patient. More recently, there's been the advent of immunotherapy, which has dramatically changed survival for cancers like melanoma.
The idea is that much as your body would fight off an infection, we harness the immune system to fight against the cancer. The patient's white blood cells are harvested, and then in the lab, they're modified by putting specific antigens on the surface using genetic techniques, and that allows those white cells to then be given back to the patient after they're expanded, and they go to where the cancer is, and they attack the cancer. Much like the immune system, those cells will stick around. So if the cancer starts to come back, those cells repopulate and grow in numbers again and continue to fight the cancer.
That only occurs by having a depth of understanding of our cancer biology, as well as how us as patients respond to cancers. Immunotherapy in melanoma has allowed us to perform less radical surgeries and even less surgeries, and the patients are actually doing much better. All of that occurs only through research that really helps our understanding.
Advances in surgery are another way that things have really changed in the last few decades. And of course, it's all gone towards a more minimally invasive technique.
We have subspecialty trained physicians to treat every cancer in the body. We offer both minimally invasive techniques as well as more radical surgeries for advanced cancers. And in many ways, our surgeons are leading the use of minimally invasive techniques for advanced cancers. The primary example is robotic surgery.
It's really a machine that comes over the operating room table, but the surgeon sits at a console next to the bedside and operates the robots. A small movement of the surgeon's hand is an even smaller move at the bedside, so it's a much more controlled and refined technique. It's not always clear where the tumor ends and where the normal tissue begins. But with this new technology, we'll be able to see that better, make sure that the margin around the tumor is wide enough that we get it all.
The relationship between the Baylor College of Medicine, Dan L. Duncan Cancer Center, and Baylor St. Luke's Medical Center is a partnership. And it's a partnership that really leverages the strengths of both institutions. It merges the cutting-edge research at Baylor College of Medicine with the state-of-the-art clinical care that we see at Baylor St. Luke's Medical Center.
Collaborative research, sharing ideas and working together is really how we get things done. And the Texas Medical Center is just amazing for that. There's just so much innovation going on. And now with TMC3 bringing in industry to collaborate together, I think Houston's poised to be a real hub in medical innovation in the next decade.
At the end of the day, we want to cure every patient of cancer, but we really are treating patients. And we're treating people like we would like to be treated. Our focus is on working together as a team of doctors who specialize in cancer to provide the best care in a timely and compassionate fashion.